Hi there, Dr. Carmen McGuinness here with you. So today I was scheduled to talk about triangulation as it pertains to typical population outside of narcissism, which is where it is usually discussed. However, this morning I woke up with a strong calling to address another topic, and that is the stress levels of children in the current situation that we're going through worldwide. Many children across the globe, most children across the globe, are currently out of school because of increased risk of transmitting the COVID-19 virus. So this is having a terrible, terrible effect on our children. I myself own and operate a private school for children with learning differences. And my private practice, my psychology practice, is largely centered around relationships of all sorts, including those with our children and between children, parents and children, siblings, children's difficulties at school, and of course marital and other relationship difficulties. But right now I'm very much focused on the children and what their reaction is to being afraid and being out of school. I think when the children were asked to leave school, when the schools were closed, that I think was absolutely the worst possible thing that could have happened for our children. Now, I'm not saying that I disagree with that decision. I actually agree with that decision. I know that there are some countries that have not closed the schools, and I think that that's very risky. However, the effect, the psychological and emotional effect to children is huge. So that's what I want to address today. I want to talk a little bit, just off the cuff, no scripts today, about how to manage our children during these difficult times. Now, certainly when my school was open, just last week, before we were asked to close until the end of March, I was telling the children I was having to take temperatures as they were coming in the door if they didn't look well, and pulse rates, things like that. I was telling them, if you get sick, you'll be just fine, because this is not affecting children that badly. It would be like getting a cold or maybe a mild version of the flu, and you'll be just fine, and reassuring them. So now I'm away from my students, and I can only really speak to them on my HIPAA secure platform if I'm called to do so. But I want to talk to parents at this point, and other caregivers, and teachers who are still in school, in Britain, for instance, where they have not closed the schools, and advise you to do the same. Reassure your children, not just you're going to be fine or we're going to be fine, but very specifically that if you get sick, you will be fine. This may well be something that they've heard in the popular media. I know a lot of the kids are speaking to other children, and they're on YouTube and they're watching the news, and they may have heard some of this. But hearing it from their caregivers and their parents is huge. That's who they need to hear it from. They need those sorts of reassurances with a smile on our face that everything really will be okay. Very specifically, if you do get sick, you will be fine. Because it's a very different thing to say, oh, you're going to be fine, it's not affecting kids that badly. That makes it seem like you're not going to get sick, but in fact some of our children are getting sick. And not just from COVID. Some of them are catching influenza or just a cold or whatever's going around, strep throat. I know we had a little girl at my school with strep throat, and she was very, very stressed out about what that meant. So very specifically tell the children, if you do get sick, you will be fine. Those are the words that I've been using with those children that I've been able to influence. So a few other things. The second thing is that if your children are exposed to older individuals, such as their grandparents or friends of yours, or maybe even you, if you're an older parent, as I am. I have children from 16 to 41, so I have all kinds of kids roaming around here, and 5 grandchildren. Well, 4 and 1 on the way. So if your children are exposed to older individuals, it's very important that they not feel responsible for their health. I do understand that, in fact, they may well be responsible if they get sick and they pass it on to them. But, in fact, that is really your responsibility as the parents, not theirs, to keep a distance. So rather than using those words, you could make Nana sick, or you could kill Granddad, it's best to say that we're going to keep everybody safe, we're going to have social distancing, explain what that is to them, practice it with your own children as well, and then just keep them away from the grandparents and other older individuals. Don't accidentally put pressure on them to where they feel that they are responsible for the safety of older individuals. That's a reversal of role, because it's the older individuals that are usually responsible for the younger ones. So don't make that mistake. That's actually called parentification when we do it. I did a video on this not long ago, probably about a year ago. Sorry, I have an ant crawling on my keyboard. So we don't want to accidentally do that, and then also possibly have someone become ill and have a child who has lifelong guilt. So, and it's going to have an effect whether they actually become ill or not, because as I said, it puts that burden on their slim shoulders rather than on ours. So that's the second thing I want to say. The third thing I want to say, and I hope it's clear to everybody who's viewing this. If it's not, please read my bio in the About section. I am a health psychologist. That is what I do. I deal with health behaviors, and I deal with behavior in general. So it's very important when we teach our children, or when we tell our children, wash your hands, to actually show them what that means. What I did with my own 19-year-old here, who's obviously not a child anymore, but when I told her to wash her hands for 30 seconds, I listened, and it was more like 10 seconds, and the water went off, and I realized, who even knows how long 30 seconds is? What does that really mean to most of us? So I asked Alexa to, Alexa, set a timer for 30 seconds, and then I washed my hands for that long and had her watch me. And I demonstrated for her how it's actually quite relaxing to wash your hands for 30 seconds. Get everything nice and soapy, wash every single finger, get the backs of your hands, get your wrists where germs can collect easily. And she said to me when I was done, she said, "Wow, that felt like 2 minutes." And indeed it really does. So I encouraged her to take her time when she washes her hands and to do it thoroughly, and modeled what that actually looks and feels like to wash your hands for that long. I had to go get a drink of water. It's warm out today. So the fourth thing that I wanted to talk about is social distancing and what that means to children and the effect that it could have on children. So we've all been asked to keep a good social distance. We're not supposed to hug, we're not supposed to kiss, we're not supposed to handshake, we're not supposed to do any of those things that make us feel connected and as if we are trusting the other person and the other person can trust us. So clearly your children know they can trust you. If they don't, then they've got bigger problems than COVID. But it's very important during this period, more important than ever, to make eye contact with your children. They're not going to see us doing the normal things that we do. They're not going to see us being our warm, fuzzy, friendly selves. And we're probably going to even be a little bit more cautious around them. When they get out, come in from playing, for instance, we might ask them to wash up before we give them a hug. So it's very important that we give them lots of eye contact right now. I'm always telling parents the importance of eye contact, but I'm really saying it quite strongly right now. Capital E, capital C, eye contact. Make sure that you connect with your children in that way. Warm smiles, reassuring smiles. Everything's going to be great. I hope this has been helpful. I think it's really important to understand that children can respond to stress and trauma in the future, not just now. So hopefully a couple of weeks or months from now, when this has passed, at least for now, they're telling us, and everything is calmed down and the children are looking, acting, feeling better, don't make the mistake of assuming that all is well, because indeed we know from decades, really, if not centuries, of observation and research in this field that children respond in the future, and it has a knockdown effect on future generations. I'll give you an example, the potato famine. Even children who were not at great risk during the potato famine, they might have come from wealthier families or been near it but not in the heart of it, even those children passed on the trauma response to their children and their grandchildren. So it's really important that we not inadvertently have a very bad effect on future generations, because they're our babies and they're who are going to look out for us when we're a little older also. So I hope this has been helpful. I do want to offer for anyone who may be in need of a remote therapy session. I do, as I said, I have a HIPAA secure platform where I see people safely face-to-face, just like this, and only you get to respond to me as well. We can see each other, and I'd be more than happy to see you. I am giving a very large discount already for spring and summer that I put up some time ago, so I can't really afford to offer more than that, but it's essentially it's about a third of the cost that it would usually be to get some brief therapy. That's brief with a B, not a G. Hopefully we will not have any grief therapy happening anytime soon. So I look forward to seeing you next week. I will be getting back to the topic of triangulation in the general population outside of the narcissistic population, and I look forward to talking on that topic. It should be really interesting, and I will see you midweek sneak peek for a little bit more on that, a little bit bigger of a sneak peek about what I'll be talking about. I look forward to seeing you then. Until then, have a wonderful week and stay safe.